close friends have spoken, I would now talk something about use of AI in patient engagement and patient education, because that is something which is critical for our practice, especially when you're practicing chronic disorders, and probably that is an area which is uh, generally not touched upon and generally not focused upon when we are practicing on in day-to-day at our centers. Now again, the start, and we'll probably, because we are in a diabetes conference, so we'll probably take diabetes as a use case for this. So we know that the stark reality of diabetes, that it's basically increasing on day-to-day basis. Currently, the IDF figure shows about 589 million diabetics in the world, living from 18 years to and above. And out of that, as per the ICMR INDAB study, which we have probably heard upon like multiple times, it is probably more than 101 million patients with diabetes living with that. Yet, the medication adherence is just 50 to 60%, and the main problem with that is the health literacy, which is both which falls both with physicians and majorly with the patients. Now, there are some critical barriers to achieve effective patient engagement. Now, first of all, it's the health misinformation crisis, which is probably everywhere around us, right? So from WhatsApps to Instagrams to everything, and probably yesterday I was looking at a picture of semaglutide, Ozempic, and also which was morphed to Mounjaro, showing infertility and showing hair loss and showing blindness, where, well, we don't have specific long-term data on that, and that has been moving from one WhatsApp to another, which ultimately leads to confusion and potentially dangerous self-management and self-treatment decisions which the patients generally take. Now, then there is limited health literacy, that which I already mentioned. So only 12% of only 12% of adults basically have optimal health literacy skills about medical terminology, treatment rationales, and self-care tools. And then again, there is constrained physician time, which we all are aware about. So the maximum consultation time which we can probably give to a patient is about 20 minutes, on an average. And in that, we barely can actually go through diagnosis and treatment and the management protocols. And of course, we don't have time to comprehensively educate and engage the patients in his own treatment. Now, why diabetes is a perfect AI testing ground? Well, there are multiple issues over here. So of course, there is medication management, which includes from OHAs to complex insulin regimes to now GLP-1 analogs, etc. Then there are dietary choices which have hundreds, and which has hundred of caveats. So it's basically cultural, which changes from cultural foods to regionalisms to personalized diet choices. Then of course there is glucose monitoring, which is from blood glucose monitors to CGMs, which we had gone through yesterday only, where there are glucose trends, there are glucose analysis, there is real-time adjustments which is required which requires continuous education and engagement with the patient. And then of course there is physical activity, which varies from patient to patient. So of course that's very unpredictable. Something which works for me will probably not work for you. So it's like that. Now, considering Banshi sir's advice, now of course touching on the ancient roots of modern epidemic, in the 20th century, the only way to understand diabetes was the sweet urine, and that was in 1921. Which ultimately had early patient education, where ultimately the early patient education was majorly fear-based, right? So that was before the widespread knowledge of diet and lifestyle modifications. It was majorly fear-based, that we used to tell the patients that probably diabetes will ultimately lead to complications. So it was more or less doctor-centric and not patient-centric. Now, of course, in 2000s, moving on to the 1980s, 2000s, there were structured programs like DP, the diabetes prevention program in the UK, or the UKPDS, or the other studies, which ultimately focused more on organized diabetes education initiatives. And then, of course, there were multiple patient gaps which were identified by using these programs, which were majorly because of health literacy issues, and then the suboptimal outcomes were ultimately hampered because of the barriers which I just mentioned in the previous slide. Now, the new imperative is basically engaging with the patient at all ends. Hence, AI comes into picture because it basically solves all the problems what we face as clinicians in our day-to-day practice. Now, traditional methods were, and we all are aware about these methods, so they were majorly pamphlets or probably written material, which again had problems of one size fit all, which is not the case. Now again, there were limited consultation time and no follow-up engagement with the patients, right? So it was the only thing we had was the PA calling the patient for a follow-up, right? So there was no tools which were helping us out. But today there is the AI which is helping us in making our practice more scalable, more interactive, and more personalized for the patient, making it more dynamic and responsive. And there is a 24/7 access where both of my colleagues were actually showing live case scenarios, and then of course continuous support is always there. Now, how does it redefine our role as physicians? So that is something which we have to understand. Now, of course, I have already talked about the traditional model, but then AI enhanced model is that you use AI as an architect, right? So as both of them were designing and were showing you live cases, it's basically we design our protocols to reach our target, to reach our goals, and to impact the patient on a personalized and continuous model. So it basically works like a symbiotic relationship between the physician practice and the technology. Now, how does it work? So it's basically bridging a gap in our consultation, in the whole consultation. So from a clinical visit where the patient is diagnosed and treatment protocols are designed, there is basically on an average there's an average gap of about 3 to 6 months between the next follow-up generally. And during this follow-up till the time the patient reaches us, that continuous educational support can be extended by AI. Right, and which solves many of our problems. So it may be logistic problems, it may be it may be the staff problems, it may be any of these problems which actually can be solved by the AI. Now there are some models which we as physicians can understand. So there are large language models where advanced AI systems are trained on vast medical literature capable of generating contextually appropriate evidence-based responses to the patient questions. So like patient can ask about insulin, ask about the protocol, and the AI agent answers that. Then there is conversational AI, which is majorly like a chatbot, which is more empathetic, culturally sensitive, and can actually speak in multilingual answers. So it can speak multiple languages. And then there is intelligent nudging, which is majorly for all the critical nudging based on events like hypoglycemias, hypotension, etc., which is majorly based on the patient's patterns, clinical data, and optimized as per the algorithm you want your AI to respond to. Now, how does it actually provide? So what's its advantage? One, of course, there is a conversational interface where natural language processing enables human-like behavior. So it's like it's more human-like. It's not a robot talking to you. Then there is empathetic response, which is more emotional, as I mentioned in my previous slide. There is 24/7 accessibility, and there is infinite patience. So we as physicians, we as humans can actually go out of patience, but a chatbot can't, right? So it's not meant to do that. Now, then, of course, there are comprehensive plans and comprehensive protocols which can be followed over here. So it's like simplified medical explanation, which is just a complex pathophysiological problems which are translated through visual aids, through simple explanations and analogs which are tailored to patient education levels and cultural context. So again, a patient staying in an urban area or probably an HNI would be very different from a rural patient. So that there it's very helpful. And then there is interactive learning modules which use quizzes, scenario-based learning, and adaptive assessments that reinforce the concepts of identifying the knowledge gaps. And then of course there is multilingual support where it can support multiple languages and explain the patient on the basis and educate the patient on the basis of their own personal language. Then of course there are smart reminders where personalized context aware reminders are delivered at optimal times, adapting to the individual routines and their needs. There are feedback loops where AI analyzes adherence patterns, providing immediate actionable insights to the patients about their medication usage and its impact on health. And then of course there is a digital coach, which is an intelligent virtual assistant that offers continuous encouragement, answering medication related queries and addressing any of the concerns the patient may have towards their health and the treatment they are on. Of course, there are models which works on personalized dietary guidance, whether it is culturally sensitive meal plans, whether it is adapting to individual needs, or whether it is respecting religious observations. And it also takes care of the cultural traditions, various itineraries, various patient specific preferences, and also based on their faith. So for example, if it's halal or kosher or etc., they're all can be integrated and can be personalized as per patient requirement. Then of course there are boosting physical, apps which helps in boosting physical activity, whether it is providing personalized activity plans where AI assesses fitness levels, health conditions and personal preferences while making a program for the patient. Provide gamified nudges where the patients can also leverage game-like elements, challenges, and again like you also have in your smart bands. So in a similar way, these apps also work. And then the real-time progress tracking, where you are actually the AI is actually AI apps are actually monitoring activities, visualizing trends, and provide immediate actionable insights on what you're achieving. And then of course those achievements are used by the apps in a form of a motivational AI content towards achieving their health goals. Now, again, coming down to the data which we are surrounded by. So it's data ingestion, where AI seamlessly ingests all the data from blood pressure monitors to CGMs to blood glucose monitors, etc. And then ultimately it analyzes in an intelligent manner, more contextualized in real time, identifying subtle trends and and predicting the potential risks the patient may have in a kind of predictive analytics, and then prioritizing the alerts as per the patient's requirement, which is based on that insights collected by that particular data. Also, it reduces data fatigue and alert fatigue, which is also common in patients who are using CGMs. Then of course, how can we fight this misinformation? We should probably not use the unvetted information which is generally available at Google, and probably use certain sites which are more not generic but more specific in nature. Then of course, as physicians and as doctors, it's our job to vet the data which is there, vet the information which the patient collects, and tailor-made as per the patient's requirement based on their accuracy and safety for our patients. It also helps in supporting families. So there is AI-powered caregiver education, where AI delivers personalized, easy to understand information on conditions, medications, and practical care strategies tailored to the patient's unique situation. There is enhanced family support by providing consistent and reliable guidance. The AI empowers the families to confidently manage the conditions. It may vary from diabetes to cancer conditions also. And then of course, there is reduced caregiver burnout, whether it is physicians or the patient's own caregivers. It reduces their burnout and their load by helping as a support system. This is a study which was published in Diabetology in 2025, which was basically a real-world evidence study that demonstrated tangible benefits of AI-powered patient education in chronic disease management, particularly improving their biomarkers like HbA1c. This had 200 odd patients, which had shown an HbA1c reduction of 0.7% when the patients were followed up for 6 months. There was another study which it followed, that's called START2, and this was a study based on eSista digital health app, which also used 191 AI-based interventions, which led to reduction of 0.4% of HbA1c in 6 months, and again leading to 0.7% reduction of HbA1c in the next 12 months. Now, of course, there are some ways and there are challenges which I mentioned, and how can we navigate through these challenges? Now, of course, accuracy of AI content has to be vetted, and the whole quality and the model design has to be vetted and understood before the patient gets misguided. There is risk of over-reliance, like many of us are using AI day in, day out, everything what we are using. So there are chances of over-reliance of AI on the AI. So we should probably not, you lose our wisdom as doctors and not completely depend on answers we get from that. And then of course there are privacy and regulation issues. We can connect everything with AI, but there are privacy issues, right? So with your data is ultimately accessible. Now, these are certain tools which generally have proven benefits in this AI patient engagement. Now there are conversational AI and chatbots. So one of them was already shown over here. So again, they can provide real-time Q&A, symptom triage, and ongoing support, reducing the staff burden with enhancing patient access to information. So two of them are ADA and ME, which is already are accepted by FDA, by the way. Now then there is generative AI content engines where that generative AI can actually generate personalized plain language explorations which are tailor-made to explanations which are tailor-made to each patient's literacy level and preferences. There is voice and speech interface, which like Dr. Nilesh had already shown. Then there is adaptive analytics and feedback, where the AI tools can actually refine the content delivery by analyzing the whole trends and making the response more dynamic in nature. And then there is integrated platforms like Ocean MG, which is like an EHR which integrates the AI and delivers reminders, instructions, and messages within the clinical workflow. Now there are some emerging trends. So of course there are multilingual models. Some of them are already there, and some of them are actually developing into better ones, which can actually talk in the native tongue of the patient, making it more understandable for the patients. There are variable integration. You can actually integrate your smart bands, CGMs, BP monitors, etc. Everything in these AI models, enabling proactive interventions and highly personalized healthcare insights in real time and in a more comprehensive manner. And there is emotion aware AI, where the AI itself understands the patient's mental situation, becomes more emotionally aware, and answers in a more human-like manner, in a more empathetic manner, and not a robotic manner. Now, what us as doctors should do? So again, we know that we play a very critical role in patients' management, and it's not limited to the treatment and diagnosis. It goes beyond that, right? So we should be staying engaged with AI use. So we should actually actively participate in development and implementation of AI tools to ensure they align with best medical practices, evidence-based medical practices, and not just Googling it out. Now, of course, secondly, guide the patients on safe tools. There are hundreds of AI tools which are available on the internet, but then not everything is safe. And then we should probably advocate ethical adoption of the AI. Now, the key message from my talk is that, of course, AI extends and not replaces physician. As shown by all of us, it's a tool, and it works like an assistant to us. It's not replacing us. So we should understand, and we should probably proactively engage our patients on the basis of the same. Then there is diabetes is a model condition where AI can offer multiple benefits, as I had already shown. There is evidence. Evidence shows better outcomes because it leads to improved adherence. The study which I had shown helped in improvement in HbA1c and improving patient knowledge. And then doctors remains at central, because ultimately the patient has to come to us, and we are the ones who are delivering the care to the patient, not the AI. Thank you.